for people with TSW, but more importantly, prevention.
James Sunderland.
Mr. Gray, it's a great pleasure to serve under you as chair, and thank you for calling me. I just want to talk about mental health support, if I may. It's something that's often forgotten about across health providers right across the UK and beyond. And it's surprising because 60% of British people currently suffer or reported to have suffered from skin conditions at some point in their life. Those figures are quite comparable with cancer. So it's a much bigger problem, I think, than we recognise. And also, 98% of skin disease patients currently report that their condition affects their emotional and psychological well-being. Yet only 18% have received any form of psychological support. So there's a dichotomy there, which I want to exploit today very briefly, notwithstanding my sore voice, which I'm very sorry. A key factor in why support for these conditions is so important is that studies have proven recently that there's been an increase in the last 2 years in particular of psychological distress. And that's in particular to adults over 18 and also children between the 6 and the 16-year group. And for over 18-year-olds, it's 20.8% who reported it in 2019 to 24.4% of people who reported it in March 21. And that, in my view, is a reflection of the pandemic from which we've all suffered. Studies also found that adults over the age of 18, 26.1% of respondents have reported self-harm thoughts at least once between March 2020 and May 21. So again, this is a hidden danger that we must all be aware of. And it's even worse, as I mentioned, for those who are a bit younger, 6 to 16-year-olds. 39.2% of children in that age group have experienced some kind of mental deterioration in mental health since 2018. No doubt as a result, in my view, of schools being closed and that isolation that we all suffered during the pandemic. So this is about the hidden dangers for me from the pandemic. This is about the cost of mental health, the cost upon individuals. And it's made worse, in my view, as young people also emerge from the pandemic, from their hibernation. How do they look? How do they feel? How low or how high is their confidence? What about not being in the sun for the last couple of years, perhaps, for those living in high-rise blocks in London, inner cities? What about skin conditions? What about acne? What about going to school at that key age for a teenager? What about the lack of confidence that comes from having a skin condition, perhaps acne? So I just want to raise it today. And of course, we can easily admire the problem, but the solution's much more difficult. But perhaps there may be a solution, as I come to in a minute. So having sort of discussed mental health, I just want to discuss dermatology, if I may, very briefly. The number of eczema sufferers in the UK has been steadily rising for the last 10 years, and it stands currently at 1.3 million people. Interestingly, eczema is diagnosed much earlier, and about 90% of the cases is actually for children below the age of 5. But in my view, psoriasis is much more of a problem for people that are slightly older. And the prevalence of psoriasis in the UK today is a very similar figure. It's about 1 to 1.3 million people. And I am very familiar with it myself. So I think psoriasis is a problem. It can affect how you look. It's just one of many conditions, as we've heard earlier from my honourable friend from Gainsborough. It's part of that whole panoply of skin issues that affect people so badly. So what can we do? Well, there's 3 key points I want to raise with the Minister. I know she's in her place. We need to improve the support for all those with skin conditions. And what we need to do is to focus on that link between dermatology and mental health. So the first one is, I want to call on the government today to review its spending on dermatology, to provide provisions for clinics to provide specialist mental health support for children and young people who suffer from skin problems. And again, as we heard earlier, that may just break that link between skin issues and the mental health that people are increasingly suffering as a result of that. The second point I want to raise, please, if I may, is to ensure that, whatever possible, face-to-face appointments are available to those who need them. And I think that's really important, because this is about the human touch, this is about human contact. A Zoom call with a doctor is fine if you can get an appointment, but it doesn't recognise the problem, you can't see it, You can't feel it. And that, for me, is very important. I think people... Please.
I'm grateful to the honourable gentleman for he's giving an excellent speech, and I also pay tribute to the honourable member for Gainsborough. This is such an important issue, and I've been contacted by a constituent of mine called Margaret, who's a lifelong sufferer from psoriasis, and much of what she said in her email to me, I think, would be very familiar to Sir Edward from his opening speech. But I just wondered if the honourable gentleman would agree with me on that point about the importance of that first contact with the doctor, about how important it is that sufferers from all kinds of skin conditions can feel confident about reaching out to their doctor. The face-to-face contact, as you say, is so important. But also just to emphasise to anybody, anywhere, who might be suffering from a skin condition, that help is available and that they should not hesitate to seek it. Thank you.
Thank you very much, and I thank you for the intervention. I couldn't agree more. And the simple answer is that you can't see anything on a Zoom call. And also, you need to be able to see a doctor to get a prescription. So if you have a skin condition, you can't just go to the chemist and get prescriptions. You have to get an appointment first, get the prescription, and that comes more from a face-to-face appointment. Thank you very much indeed for that. And my third point to the Minister is that we do need to increase the range of psychological support for all those who need it. And that's part of that panoply of mental health support that we need. Just to conclude, if I can, a study in 2014 showed that patients who have completed psychodermatology treatment, 94% reported reduced stress, 92% reported increased confidence, and 90% reported that their skin condition was better understood. Wow, those figures are amazing. But at this current point in time, if you ask for that, it takes up to a year for a referral, which is worrying. So to conclude, if I can, Mr Gray, I first want to commend the excellent services locally in my constituency. Frimley ICS is one of, if not the best performing ICS in the country, and the treatment I've had personally has been pretty good, notwithstanding the delay that we're suffering from. And lastly, if I may, to the Minister, just to please reinvest accordingly in this very important area so that young people and adults aren't suffering.
Order.